Assalamu alaikum. My name is Fahmeed Nasir. I am a student of PhD Pharmaceutics in Government College University, Faisalabad. And currently, I am working as assistant professor in Yashvin College of Pharmacy, which is a project of Yashvin Education System, Lahore. I am highly thankful for the organizers for giving me to this a great opportunity, and I feel myself very privileged to be a part of this third international Brain and Biomedicine Conference IBBC 2024. My topic is formulation and characterization of sol gel processed microspheres of lidocaine HCl and nitrofurazone and their loading in sodium alginate scaffold. In this project, I used two API. One of them is lidocaine HCl, which is local anesthetic for pain relieving effect, and nitrofurazone exhibits the antibacterial effects. And microspheres were prepared by the process of sol gel method and which contains the ethyl silicate. Sol gel technology nowadays a very useful technique in which we firstly prepare a sol and then it will become a gel and we prepare microspheres. And ethyl silicate contain silica, which is a tremendous ingredient for the wound healing. And nowadays, researchers use this ingredient, silica or silica particles or silica gels for the tissue regenerative property. The same wise, I use this silica for my project. Microspheres prepared showed a very good drug release and characterization studies showed very good morphology, drug release, entrapment efficiency, and most importantly, the drug release followed the Higuchi model. And microspheres were incorporated then into the sodium alginate scaffold. Sodium alginate is very useful for the exudative wounds and the wounds which contains the blood, the exudates. Actually, it swell up when in contact with the liquids like exudate. So this project showed a very good properties for the exudative wounds like a hemostatic effects. Okay. Now the introduction of clinical need is it countered or my project countered the very traditional challenge and which is the local pain relief and it provided the dual therapy, which is the combinational therapy, a pain relieving effect, and the second one is the antibacterial effect. As I discussed earlier in abstract, that my aim and objective was to prepare a sol gel processed microspheres which contain a silica for tissue regenerative properties, for pain relief effect, for antibacterial effect, and they are loading into the sodium alginate scaffold, and scaffold showed a very good properties for exudative wounds for enhanced topical drug delivery therapy. The methodology I adopted for the sol gel technique, as I discussed earlier, the sol firstly prepared and then it converted into gel and microspheres were prepared. Now, if I discuss briefly, then sol preparation contains the distilled water, silica, ethyl silicate, or the tetraethyl orthosilicate, which contains the silica, and the 0.1% HCl. In second step, the drug solutions were prepared, and I incorporated them into the sol. And the prepared sol drop wise added into the vegetable oil And then yellow line homogenizer was used at the speed of 1000 rpm to obtain the microspheres. Microspheres were separated. In second step, the scaffold preparation, we fabricated scaffold by the freeze gelation method with quite or slightly modifications. It is a very simple method. In this method, we took 300 milligram drug-loaded microspheres, and then I froze it, and then the freezing overnight was done, and this frozen, you can say the sodium alginate and dispersed drug-loaded microspheres were then immersed into the solution. And solution of what? It was the for gelation process, and the solution was the combination of ethanol and the calcium chloride, which provided the cross-linking and the gelation. After specified time, the frozen sodium alginate which was immersed into the solution were taken out and dried at room temperature, and I obtained the drug-loaded microspheres. Then they loaded into the scaffold. So finally, I got the scaffold which contains the microspheres in which dual drugs were successfully loaded. If I talk about the characterization, then FTIR analysis showed there is no significant interactions between the lidocaine, nitrofurazone, sodium alginate, and the silica matrix, and the peaks we can see visibly. STEM analysis show very interestingly that the round microspheres and the drug-loaded scaffold or microspheres loaded scaffold demonstrated the high interconnected porous network. And if you talk about the microsphere suspension, so microspheres suspended in or homogeneously, or you can say it is the very good suspended microspheres in the scaffold. XRD pattern showed that the drugs were fully entrapped and in the microspheres. And TGA and DSC, thermogravimetric analysis and the differential scanning calorimetry confirmed that the porous or confirmed the presence of drug in the amorphous form. DSC confirmed, and the TGA confirmed the drug loaded in microspheres successfully. Zeta potential and zeta sizer confirmed the micro size and the very good significant stability. In vitro drug release profile, as I discussed earlier, that it showed the Higuchi model. Porosity of the scaffold was 60 to 80%, and it is a very good for the wound healing. In vitro antibacterial performance was done by the performing a very good test, and which is the zone of inhibition, and it confirmed the very good antibacterial performance. Cytotoxic studies were performed and confirmed that the very acceptable formulation, and because it showed the very minor cytotoxic studies. Skin irritation studies confirmed the very minor skin irritation, or you can say the rapid eradication of infection. And in vivo antibacterial studies confirmed that no bacterial reoccurrence or regrowth was observed. So it is a very good for the for the wound healing, for the superficial wound healing. And at the conclusion, Sol-Gel processed microspheres embedded in sodium alginate scaffold demonstrated effective dual drug delivery with excellent swelling and porosity, making them promising for wound healing application. These nitofurazone and lidocaine-loaded scaffolds show strong potential as advanced dressing for acute and chronic wounds, warranting further in vivo and clinical evaluation for the scaffold, as I performed only the in vivo for the scaffold. Thank you very much. If you have any questions, you may ask. Thank you very much.